Hi, thank you for joining me today. I'd like to take you through a common gynecological procedure, a hysteroscopy, in today's gigs. So stay tuned after this. Today, I'd like to take you through a hysteroscopy. It's a common gynecological procedure where we insert a camera into the uterus to have a look inside the uterus. So here's the operating theatre. It's just some bright lights. I'm turning the video to black and white in case you're squeamish about procedures. Now the camera is inserted into the cervix and water is constantly pumping through the uterus to try and open up the cavity so that we can see more clearly. And this explains that current that you see. Now if you look over this way, that hole is the entrance leading into the left fallopian tube. And we're going to look at the other side now, look at the right fallopian tube. And you can see there's a very small bump along the cavity, and that is a small endometrial polyp. Now we pull back to look at the rest of the cavity, and it is nice and regular. And we're coming out and you can see the cervical canal, which looks like a tunnel on the way out. So this procedure is usually done as a day procedure under anesthetics, and it takes about 10 minutes to do. You get to go home on the same day of the operation, and because there's no cutting involved through the skin or muscle, recovery is fairly fast. We usually do hysteroscopy when we need to go inside the uterus cavity to have a look at the lining of the uterus, to look for lumps and bumps such as polyps or fibroids. And that's the hysteroscopy procedure. Thank you for joining me. I'll see you next time.